Welcome back to Jersey Matters. I'm Larry Mendte. Breast cancer is the second leading cause of cancer death in women. But Jersey Matters' Kimberly Kravitz says that there is a new treatment that could cure it in minutes. This is exciting. Kimberly.
1 in 8 women will develop invasive breast cancer during her lifetime. But what if you learned that you could now freeze breast cancer in its tracks?
There's a stigma, I'm afraid to get my mammogram, I don't want to have breast cancer, I don't want to have surgery, I don't want to have all this stuff. Well, what if I told you, yeah, we'll find your cancer and in about an hour later, you're done?
It's the words that no one wants to hear. You have cancer. But what we are learning from Dr. Kenneth Tomkovich of Princeton Radiology is that this does not mean a death sentence.
If we can use a machine like this, the ProSense machine, to freeze breast cancers and to kill them, without any surgical excision. 10 years ago, no one was really treating breast cancer with ablation therapy. So what I sought out to do was to start some research and to see if that was even a possibility.
And just with the nick of the skin, a flash of cold, and less than 1 hour on an exam table is a cure for breast cancer. But does it work for everyone?
Not everyone's a candidate, but if you are the right candidate, then we have a conversation with them about this procedure, what's involved, the whole process, and then they would come back into this room, and this is where we do our ablation procedures. They're awake and alert. We only use a local anesthetic. We don't use any kind of general anesthesia. We play some music and we talk during the procedure so they're comfortable. And then what we do is, after we give the local anesthesia, we place the probe in the breast with a very tiny incision, about a 1/4 inch incision. We watch the whole thing under ultrasound. And then in about 30 to 45 minutes after the ablation is done, they walk out of the room.
Muriel Smith was a lucky candidate for the cryoablation therapy.
I had cancer for 47 days because of Dr. Tomkovich, and that was it. I found I had it, I had the ablation, it was gone. That's the end of the story.
This is normal breast tissue here, and see where these outlines are? That's your cancer.
It's the needle that freezes the tumor, and I could see the tumor itself. It was very exciting. I'm also fairly religious, and I believe that it happened to me for a specific reason. I happened to be living in Freehold. I happened to have had a stroke, which by the way is fine, but I happened to have had a stroke so that I happened to get this email. So I happened to be there at the right time, at the time that Ice Cure was doing this, and Dr. Tomkovich was just starting to be in the trial. So they were all coincidences, and when you have that many coincidences, there's a real reason for it.
So what are some best practices to avoid a breast cancer diagnosis?
Yeah, I think preventing breast cancer, we don't know how to do it yet, but we do know how to diagnose it, and we do know how to find it sooner. So yeah, regular mammograms. I advise all women who are 35 and older to get a baseline mammogram.
About 250,000 women received a breast cancer diagnosis in 2018, and 42,000 died of it. That makes breast cancer the second most common cancer in women.
Out of like 200 patients, we've had only 4 recurrences. And if you compare that to surgery, the surgical lumpectomy that we were talking about, in the best hands, that's like 94, 95%.
To date, thousands of women have experienced the benefits of cryoablation globally. Reporting from Princeton Radiology in Freehold for Jersey Matters, I'm Kimberly Kravitz.